Welcome to the Friday's edition of the John McEntyre Show Live. I'm John McEntyre, and today, this is Medicare Friday. I know you're probably thrown off here that Andrea is not on the set with me, but she's extremely busy right now, and she's on the phone and with clients, take care of them, and so I'm having to do this by myself today. But it's all good. We're going to be talking about Medicare and Medicaid and how they work together because we get that question a lot. Some people they may be on Medicaid or some may be on Medicare and Medicaid in different levels. We'll cover some of that today, and um, a lot of people it could be just very confusing. But before we get into that, I did want to thank everyone for the actual all of the um, questions, the comments. Um, they didn't pertain. A lot of them did pertain to Medicare, and so I will be covering those next week. Um, but also the wallet wins. People that are out there, they're winning with winning the wallet game, um, and that's always good to know. And I celebrate those people that are actually winning. They're playing it right and they're winning, and they're turning those small wins into those big goals that they're goals and dreams that they're after. But one thing that is sort of alarming, I saw a report uh, yesterday, yesterday afternoon, that the use of those buy now, pay later um, type of financing options are, are are like going up significantly. Like in the past few days, they've jumped like 37%, and then it's 60% in some age groups, things like this. And a lot more people are saying that they're planning to use those buy now, pay later type programs to finance their Christmas. And we all know that that's just another form of debt. A lot of people, these aren't new. Buy now, pay later. They're definitely not new. It's just that now that they're much easier to access. It's easier. There are a lot of companies out there offering those programs, and so they can be they can be dangerous because it is another form of debt, and that means that people are buying Christmas with debt, and then they've already financed Christmas going into next year. And if one payment is missed, something like that, 35-40% interest rates. So that can be a very dangerous thing. But I just want to make sure and stress, let's just be responsible with um, I mean, personally, if you're doing a budget, I have plenty of people that's letting me know that they've budgeted for Christmas, that they've set aside a certain dollar amount for each gift and for each person that they're going to buy something for. And as we get closer to Christmas, I'll share some of the tips that have worked for me and people that I know they've shared, and time again, they've always worked. So, but I'm going to get off of that because today is Medicare Friday, and we are what, almost 3 weeks left in AEP, and so people are moving along with enrolling in their new Medicare Advantage plan or their prescription drug plan, their Part D plan, and so that's what we want to discuss today is basically how Medicare and Medicaid work together, and answer the question, should are using both okay? Well, first of all, understand Medicare and Medicaid. Some people use them interchangeably, but they are two totally different programs. Um, Medicare Medicare is for was created. They were both created at the same time in the same year, 1965. Medicare in the particular at that time was created specifically for older Americans, and Medicaid was created to address low income Americans. So it was income driven. Medicare was age driven. And then Medicare eventually, it went through some transformation, and then people with disabilities, certain disabilities, was also added to the Medicare. Um, Medicare, it is a federal health insurance program, and for people over 65 as well as certain disabilities, whereas Medicaid is a social welfare program that provides free or low cost health coverage for people and families of low income. Um, Medicaid, it's Medicare is specifically federal. Medicaid is like jointly, it works jointly, federal and state. Medicare works on the state too. It responds. It's more responsive, whereas Medicaid is just state specific, um, and there's no age requirement for Medicaid. Medicaid, it offers insurance to many children via the CHIP program. Most people have heard about the CHIP, and it's like I say, it's basically income driven. Usually people below the poverty level, the poverty line of each state, they can qualify. They're not automatically given it. You have to apply for it. And people below that level don't have certain assets in their name, a lot of assets, a lot of money in the bank and things like that, because if you have all of that, then you should be able to take care of yourself. um, so this is Medicaid, specifically state driven for low income families or individuals. All right, so um, the two, they do work together as far as Medicare and Medicaid goes together. Um, and when they do, if you qualify for both, you, you can actually receive some excellent health coverage. Um, while Medicare may be your insurance, Medicaid, it kicks in and pays for all those costs associated with Medicare, like your Part A, B premiums, your deductibles, your core insurance costs, and depending on the level that of Medicaid, because there are some different levels of Medicaid that works with Medicare. Uh, Now the thing with Medicare and Medicaid working together, you will have a smaller network of doctors because you will need to find doctors that work with Medicare and Medicaid. Um, and rarely will you find a doctor. I've yet to see one that works with Medicare but doesn't work, works with Medicaid but doesn't work with Medicare, and vice versa. I rarely see it, because most doctors, they're like any other. They are business people first, and everything. They're healers and they take care of people. They're people helpers, but to stay viable, they have to respond to the markets that they're in. And so if they are accepting Medicare in the area and there's a high number of Medicaid recipients, then they will probably accept Medicaid. Now, the people that's a special group. It's a special group of people that qualify um, for Medicare and Medicaid. They're called full duals, or you may see the initials QMB. Some people, they don't they may have had something for so long that they don't know, or they may know that yes, I do receive Medicaid. I just don't know, what it's called. Well, full blown, when you receive Medicaid and Medicare together, you qualify for both of them. That's called QMB, and that's a qualified Medicare beneficiary, which means that you have no copays for Medicare covered services that you get from doctors who participate in both Medicare and Medicaid. Uh, and you also can take advantage of other non medical Medicaid benefits, such as long term care assistance, food benefits, those types of things. Uh, was it Meals on Wheels? The big popular one most people have heard about. Then you get on the state and local programs. They may have their own programs in their own jurisdictions that Medicaid will cover. And so that's what being full blown. Now, so you can actually see the benefit if you qualify for both Medicare and Medicaid, because there's some things that, for instance, Medicare, if you you're on Medicare and you get a Medicare plan, there's some things that Medicaid doesn't provide that you can receive from the Medicare plan, and Medicaid helps pay for it. So you can see the benefits for it. Now, I mentioned that there are other levels of Medicaid savings program, Medicare savings programs. Let me get that right. Say, for instance, you didn't qualify for full Medicaid, you may still be able to get assistance with part of your Medicare costs. Just because some people say, well, I applied for Medicaid and I was turned down or whatever, and so I'm never do that. Well, there's other Medicare savings programs that are out there, um, and based on your state's limits and incomes and assets levels, you could qualify for one of the other those of those programs, and this helps to pay for some of the out-of-pocket costs associated with Medicare. So every little bit helps. That's why I say people, really stick with making sure you've exhausted all resources that are offered, because most people don't. These programs, they are out there, and people don't know what they will do, and they don't know about them, and so hopefully this will trigger some of some thought processes, and get you to look more into these types of programs. So, for instance, let's look at specified low income Medicare beneficiary, SLMB. That means that Medicaid will pay for your Medicare Part B premium. It will help with the Part B premium. That's always good. Uh, you could qualify for the qualifying individual, or QI. And Medicare, that means Medicare will pay for your Medicare Part B premium. Uh, this is the one qualified QI. Medicare pays your Part B premium. SLMB means that Medicaid will pay your Medicare Part B premium. So you have to remember to keep that in mind also. Then you have the qualified, disabled, and working individual. Most time on cards, sometimes you may see QDWI. This means that they may help pay for part of your Part A premium if you are a working disabled person who lost your premium free Part A when you went back to work. You might not qualify for this program because you went back to work. Well, you may qualify for QDWI now, and so you have to keep that in mind. So those are the three other programs. You have the QMB qualified. They're called dual eligibles. If you've seen any of the commercials, the Medicare commercial, they talk about dual eligible. Those are QMBs. They qualify for both, and they don't pay for too much of anything out of pocket. Um, Now, a question has been asked. Some people, they for some reason they don't want to do a Medicare plan, whether it's Medicare Advantage or Medigap. So the question becomes: if you're on Medicaid, do you still need Medicare Part D? And the answer is yes, because uh, they don't provide prescription drug coverage. They pay for it. They will help pay for your Medicare Part D. They work in tandem with Medicare. Remember that. So Medicare, it requires you to enroll in Part D, and if you don't, they will automatically select the plan for you. That's why it's important for you to do that yourself. And it's better because it's better to choose for yourself, so you can get the coverage for your specific medications. Because most of the time, what Medicare do, they would probably just choose the most robust plan or the most popular plan in the area. There's some ones that they've always worked with, so they may just choose it. And the good news is that people with Medicaid automatically qualify for what is called Medicare Extra Help for Part D for your drug plan as well. And even though you can qualify in this manner, the program is not Medicaid Extra Help. It is called Medicare Extra Help. So we have to keep that into me. And that means, you know, the benefits of these is that they can lower or even eliminate your premium. Now, if you're on a Medicare Advantage plan with Medicaid, then you don't have a separate Part D. It's part of the plan. It will be part of the plan. So, but if not, if you just have Medicaid and Medicare, then it can your drug plan, it could actually lower or eliminate. Depends on your level of qualification. Uh, which means that you will be paying no deductibles. Your Part D drug plans in 2025 can have a upfront deductible as much as $590. Um, but with this extra help, your low income subsidy eliminates the deductible for you. Uh, you will get your drugs or low drug copays from day one without having to satisfy any deductibles. So that's always a good thing. There have been some changes in the drug D plans, like no, you don't have to go through the uh, donut hole. You don't have to go through all of this. It's just this is what it's going to be for the year. This is what your deductible is going to be. This is what the premium will be. This is what your copays. This all of this good stuff. Well, if you have Medicaid or extra help, Medicare extra help, then you know that you're either going to have a low premium, if a premium at all, or if you do, they will eliminate the premium. They'll just pay all for it and do away with all of the co-pays from day one. Uh, so that's always a good thing. That's always a good thing. So I hope I answered that question, and I hope that for some people it may trigger something, maybe to remember you need to contact your state Medicaid program, and every state has one. You just contact them and go through the process. You don't have to go anywhere. It's someone local. Uh, your local offices that provide all of the different programs in the area. Just contact them, and they should take it from there, helping you to apply. And it's not a long wait from what I understand. What I've seen. I've seen some people, in less than 2 weeks, they know whether or not they've been accepted. It all depends on they're gonna do the check to make sure you're not a millionaire or some person out here that can take care of themselves, that can afford insurance and everything like that. Because, like I say, Medicaid is income driven. It is income driven, and these programs that work with Medicare, that Medicare provide, those are income driven also. So you can't be, a person, um, on a big, robust retirement pension plan, and you're making tons of money, and you're just trying to beat the system. It won't work. People have tried it. It won't work. Eventually, they're caught and everything. So, but these, you see the benefits of what this can be for you. So I hope this information was useful. I didn't want to give too much because it's already confusing, and there's a lot. Remember, Medicare is federally driven, Medicaid is state driven, Medicare is age, 65 and over or disabled. Uh, Medicaid is income driven, so babies can be qualify for Medicaid. I'm sorry, for Medicaid. So just remember those types of things. So if you found this information helpful, or if you need more information, our information is on the screen below. Um, Give us a call, contact us, and we'll help you make the right decision for you, and to point, or at least point you in the right direction for you to get the assistance that you would need. So if you're watching by YouTube, subscribe, give us a thumbs up. If you're watching by Facebook, subscribe. Or like the channel, share it, follow, do all of that. Give us a like. Let us know. Give us your questions, your comments. Definitely share those wallet wins. If you apply for Medicaid, for instance, and you receive it, let us know. We may want to talk to you with the process. We want to know how the process was for you and everything, because we're constantly doing research so that we can help more viewers with this information. So, with that being said, I hope you have a good weekend. Stay safe. We'll see you Monday. We'll talk.